And I'm just going to say welcome everyone to the Region 15 Town Hall. I'm Jason Kirchick. For those of you who don't know me, I'm your regional coordinator for Region 15. Very excited to be with you all this evening. We have quite a great lineup of guests this evening. And just so we can kind of stay within the hour and give you some time back this evening, I'm going to try to keep things moving along and keep it to the hour. We have Eric Shemek. Am I saying that correctly, Eric? Because I will torture it.
All good. No Arik Shimmick, but trust me, we can thank my mother for that gem of a name.
I got to know Eric because of my involvement with the Global Virtual Academy at Sigma. Did a research project on involving nurses in advocacy and policy development. Very excited that I got my research selected to present at biannual this year. Cheryl Shields, who's also on the call this evening. Cheryl is our chair for our strategic plan committee for Region 15. Cheryl also did the Global Academy and is going to present on her work. And then we have a very special guest, Oliver Shears, who's on, who was handpicked by Deb Kramlich, our previous Region 15 coordinator, and he's going to present on his work. And so I'd like to turn it over to our presenters, and I'm first just going to turn it over to Eric to talk a little bit more about the Global Academy and your work with Sigma.
Sounds good. Thank you very much, Jason. Good evening, everyone. Hello from a actually sunny Chicago for a change. As Jason mentioned, I have been involved with Sigma's global team since 2019 when I began serving in a role as a liaison to the UN on behalf of Sigma. So very happy to be here and actually see quite a few familiar faces from the Academy in past cohorts, but wanted to just join tonight to share a little bit of information about the upcoming cohort in case you have anyone who might be of interest. Applications are currently open. They close on the 25th. And we are starting a new cohort in early April on the 1st. So what this is, if anyone isn't familiar with it, is a 6-week blended online program where former UN liaisons and youth reps kind of continue the conversation with our members about advocacy. As a profession, there are a lot of great options for us to get involved at the local and state level, and certainly through the licensing options or regulatory bodies that we have. But there's a lot of space and a lot of opportunity for us to get involved on a global level as well. So the Academy tries to squeeze probably quite a lot of content into these 6 weeks, but it's 2 recorded sessions and 4 live meetings with kind of a capstone project at the end, which Jason mentioned is usually a catalyst or a precursor to either a publication or presentation. But we really want to make sure that people are both aware of this unique identifier that Sigma has, but also understands that each of us as a nurse really does have the opportunity and the ability to come to the United Nations, to share your story, your work, your research, to make sure that we're not just talking about what nursing looks like in our jurisdictions, but what does health in all policies really look like across the globe. So looking ahead to this year, the International Council of Nurses has their biennial conference in Helsinki in June. Hope to see some of you there as well. You'll see a few Sigma alumni presenting their presentation. But really, I just wanted to join, answer any questions that might be there. But yeah, just kind of highlight the fact that this is something that Sigma does that I don't know that a lot of our members really connect with outside of some of our larger events. So whether it's in Helsinki in June or at our biennial convention in November, we will be having a session in November about the Academy. We'll all be there, happy to connect both online or in person. But just wanted to share the opportunity because it is a pretty tight deadline, quick turnaround time, but we will have another cohort again in the fall if this spring doesn't work out for you.
That's really great. And I went ahead in the chat. There should be a link for everyone if they want to learn a little bit more about the Academy. And again, applications close for the next cohort March 25th. So I know that's coming up quick, but I highly encourage it. There are just so many wonderful resources, people. You can connect with peers. You can work on a project with other people. It's collaborative. I had such a positive experience with it.
Yeah, I was going to make a joke about the fact that we're both wearing our Sigma uniforms today, but in meeting the different members, people that come through the Academy has been really for me quite inspiring because I've always felt a little disconnected geographically. It's hard to sometimes work with people that you haven't met before, but the whole intent of this is to team build, to again tell your story at a global level. And I had the chance this Monday and Tuesday to be at the UN for the Commission on the Status of Women. Met a couple people from the last 2 cohorts, and they just were like having this moment of like, it's so nice to meet you in person. Where do our lives like intersect? How can we work together? And to me, that's one thing I love about the Academy is, yes, it is a small time commitment. It's only only 6 weeks, 2 hours a week, but it has the potential to really turn into some great working opportunities for us. And I think in a world where there's so many people who go to the UN trying to kind of pitch themselves, trying to tell their story, it's important that we as nurses have a unified presence, a consistent message, and a consistent presence in the room in those meetings, because people are making decisions about healthcare and health policy without asking us, without asking nurses what their input is. So I really do encourage anyone who's interested to check it out, and I'm always happy to answer questions offline as well.
Does anyone have any questions or anything they'd like to ask?
You can get the Sigma shirt on sale. No, I'm kidding. We don't get any kickback for our sales here, but I'll tell you what, it is pretty comfortable. I had to laugh when Jason and I both popped on wearing our uniform tonight.
Eric, thank you so much for making this time. You're obviously welcome to stay on, but if you need to get your night back, that's fine. And I'm sure I'll be seeing you around soon at another event or LinkedIn somewhere.
Yeah, happy to hang out for a little bit. I do have a spouse that is on the way in from the airport. So as soon as I hear that door, I'm going to jump off, but happy to hang out and answer any questions that you might have.
Perfect. Well, I think this is a good segue to introduce Cheryl Shields, who also attended the Global Academy and is going to present on her work. And Cheryl, do you need me to allow you to share the screen?
Yes, please.
Let me go ahead and do that. You are good to go.
You can see that?
I
Yes.
can.
Okay, great. Jason mentioned I did attend Sigma's Global Health Equity Mini Academy. Oh, it was the fall of 2023. This is my action plan, which was my culminating project. And my background is as a nurse educator. And one of the things we try so hard to do is to teach our students how to educate their patients about things like nutrition and exercise and their medications. If we don't spend some time on educating our students about the social determinants that are so impactful on patients' ability to maintain a healthy lifestyle and be what we say compliant with their plan of care. So my objective here, and it still is to try to inculcate the importance in faculty and to pass that on to their students. So I concentrated on good health and well-being, which is goal number 3, and reduced inequalities, which is goal number 10. So the ultimate goal here is to improve overall health and for patients, but also on a larger scale, if we can get nurses on board with this, to have a public health impact as well, global and as well as national. So the social determinants of health are, when I was teaching at least, and that's not that many years ago, I was teaching undergrads, social determinants of health were not part of the curriculum. And I think it should be. My goal again is to get faculty on board with this and to start incorporating this even at the undergraduate level. But we need to raise awareness, public health awareness, to promote change. We need to look at how to educate, including our students, for the teaching skills and advocate, the importance of nurses in their ability to advocate and improve health access, and also enforce ethical standards. So health literacy, we need to focus on the modifiable social determinants of health. We have to focus on those things that can be changed through policy or intervention or individual actions. So health literacy on a personal level is the degree to which individuals have the ability to find and use information for health-related decisions. And depending on your role where you work, you may also have an impact at the organizational level. And the link that I put in the slide is excellent. Jason, if we can share the slides later if you want, but the CDC has just a plethora of great information on health literacy. So if anyone's interested in taking a look at that, I encourage you to take a look at that link. So the role of nurse in health literacy, I think, again, has just not been promoted to the extent that it should be. We need to partner with individuals and healthcare organizations and community groups, but if we don't start getting that information to our students so that when they get out and graduate, they're able to make an impact where they're working, then we're not going to be making much of an advancement in getting the social determinants of health as part of their basic education. So we can collaborate with colleagues and educators and community organizations. There's a lot we can do if nursing is more aware of the importance of the role that they play. So here are some health literacy advocacy campaign strategies, and actually my DNP students are going to be doing some of these strategies as part of a project that they're doing in my population health course this summer. But things like health education workshops, health literacy videos, community health fairs, health literacy programs in schools, there's lots of different advocacy strategies that they could try. Methods of training advocates, educational workshops, online training modules, mentorship programs, mock advocacy exercises, and even an advocacy certification program that will recognize achievement and competencies of advocacy. Potential collaborators, some of them would be community-based organizations, academic institutions, libraries, senior associations, cultural and language-specific groups. And of course, since we're nurses, we have to assess the outcomes. So we're looking at validated health literacy assessment tools. RELM is a great one, TOEFL is a great one, and also the newest Vital Sign. These are validated predictors of health literacy to measure changes in health literacy levels. So again, there's a list here for additional ways to measure. And some of the important things would be getting feedback from the people that are involved, like through focus groups and community feedback and stakeholder partner feedback. So basically, to wrap it up, my goal is here to get faculty and students on board with the social determinants of health and how they play a key role in health literacy to manage modifiable social determinants of health. So what I did was I put together a 6-week curriculum teaching the social determinants of health. To circle back to education, I think some of these strategies could be used at an undergraduate level, graduate level, doctoral level. I am definitely going to be using some of these educational strategies in my doctoral students in the summer, so I'll have feedback to see what happens with that. But I believe that the time to start is in the undergraduate student population. They need to be introduced to the social determinants of health, because all the education we provide to patients and their families is not going to work if the students don't take into consideration the communities where patients live, the access that they may or may not have to healthcare, their literacy level. To me, it's part of building the skills that students and nurses need to educate their patients. The end.
So well done, Cheryl. You know, when I was in my Master's of Public Health program, I had a health literacy course. And I don't know if you know of Helen Osborne, Health Literacy Out Loud. Heard of that at all?
No.
I'm going to drop a link in the chat for everyone, or something that you just may be interested in, maybe not.
Okay.
It's so important. I think that, you know, when we are speaking and engaging with our patients and their families, something I try to remind not only myself and colleagues is that just because we've taught something once doesn't mean that it's going to stick. And too often, patients and families will give the nod when you're speaking as though they understand everything. And I have to also admit that I don't know everything. It's impossible. I have one specialized sort of field that I work in within nursing, but that doesn't mean I understand. You know, as an oncology hematology nurse, you know, that's my lane. But put me in orthopedics or, you know, mother baby, not a clue. So, you know, just a wonderful topic. The presentation very well laid out, and wondering sort of where you are with doing that curriculum. Is it going developed it for like a course that people can take, or what's your next steps?
So for now, I am incorporating it into the population health course. I teach that in the summer to the Doctor of Nursing Practice program at Bay Path University. So I am actually revising the course, Jason, to include this, shifting some of the assignments around. But at the same time, I'm also hoping to get an 8-week course incorporated as part of the program. So we'll see where that goes. Right now, we are just trying to focus on getting our accreditation re-upped. So our curriculum revision is planned for after April. So we'll see what happens with that. But the faculty is on board. They're very interested in hearing more about it. And the nice thing about Bay Path is we do have 8-week sessions. We have 14-week sessions and we have 8-week sessions. So this would fit really nicely into an 8-week session.
That's great. Open it up to others, other feedback for Cheryl or questions. Karen.
Yes, hi, Cheryl. That's very good. Thank you so much for that presentation. I teach community health nursing to the seniors, as well as I teach professionalism and patient-centered care to the sophomores. And I talk about a little different flair, but I bring up about, obviously, you know, I saw you had healthy, you know, people 2030 there, but also the determinants of health, which relate to obviously the social determinants of health. Excellent presentation. So I am teaching it at the undergraduate level. And to back up what Jason said, so they get tested on it, they learn about it, we talk about it at the sophomore level, and then it's so nice. I have them again in senior level at the community health nursing course. Again, they learn about it. Again, they do this. And so it's really good, and more education needs to be brought to the forefront. So thank you. That's really exciting that you're developing that. Great. Good job.
Well, I'm happy to send you the 8-week curriculum, and you can use as much of it as you want
Oh, thank you for sharing. Wow. That's a gold mine. Thank you.
to. You're welcome.
If you want to put in the chat or just email me the presentation, I can include that in the materials that go out for the follow-up.
Sure.
And Nancy, did you have something?
Very well done, Cheryl, but everything you do is very well done and so timely. I will share with you that, as you know, I teach in the undergraduate and accelerated programs at UMass Amherst. We have worked this into our curriculum, not in a structured way as you have designed here, but it's throughout our community program as well as discussed throughout other courses. And I'm finding of late that students come with a knowledge that nobody lives like I do. There are people that live with a lot less than I have, is what they say. And they're more sensitized to it than we ever were, or aware of it more so than students were even 5 or 6 years pre-COVID. They're more aware of it now. And you're absolutely right. We have to have this as a part of our curriculums, because it doesn't matter that I'm teaching you something and you're nodding your head and you agree. If you live in a different environment where these resources aren't available to you, like a car or a bus route, you may not be able to do what you need to do to maintain your health. Or your health is compromised by you're living somewhere near a highway and there's a lot of traffic. And you're out and your kids are playing out in a concrete playground where there's all these exhaust fumes that they breathe and how that affects their non-well-being. It's so important. This is so important to belong in our curriculums. And I think making not just nurses, but all healthcare disciplines aware. Physicians, physical therapists, OT, social, everybody. I think probably social workers, I don't know. Maybe they don't, are more aware than we are.
Yeah.
So thank you very much.
I think especially, as you know, I'm all about workforce diversity, but I think there are so many underserved populations for which this is just absolutely critical. So yeah, thank you for your.
I think too, we place our students in our community course in settings like, for instance, the Rescue Mission in Springfield, Seniority House, which is a large apartment complex for those who are 65 and older who challenged financially. So these students are now part of this. They want to learn new skills. And I have to say to them, this is the other side of your nursing skill learning. This isn't the clinical stuff. This is the other side, the art of nursing and looking at observations of people and where they live and how they live, and how that affects their well-being or non-well-being. So I think putting students, having programs like what you structured, but also I think having students experience it, doing service learning, that is a huge way to hit it out the ballpark and hit it home to these students.
Yeah, we took students, as you know, I did 5 medical missions in Jamaica with students, and many of them had never traveled outside the United States, first of all, but secondly, they hadn't been to Jamaica other than to a resort. So, that's a whole different side of Jamaica than what we were doing in inner city clinics and in the bush. And it is such an incredible learning experience when they do go out of their comfort zone and experience what other people don't have and how they make do with what they do have.
That's great, Cheryl. Thank you so much for your presentation and making the time. Now we're going to segue to our last highlight of the evening. We have Oliver Shears, who has joined us, and this was based on a recommendation from Deb Kramlich, our last regional coordinator. And Deb, I don't know, are you okay kind of introducing Oliver, since you know him a little bit more than I do, and he has a great presentation tonight for us?
Sure. I'm happy to give a little brief introduction. I know you put Oliver's bio in the message that went out, but Oliver, how long ago did you graduate from our nurse residency program? Was it about 3 or 4 months ago?
I think it was in September
Oh my gosh.
2024.
That long ago already. Yeah, so Oliver was in our nurse residency program at Maine Medical Center, Portland, and this was his evidence-based practice project that he conducted throughout the nurse residency, and it is just a fabulous topic, very timely, and I think the previous 2 presenters segued nicely into to Oliver's presentation. And Jason, I sent you his slides. Do you have them or?
I do. Would you like me to bring those up for you, Oliver?
Yeah, absolutely. That would be awesome. Thank you.
Okay, I'll get that up. And I know that we're going to try to see if we can get Oliver to join Sigma, maybe get inducted as a nurse leader. But thank you, Oliver, for being here. I think this is up. And then when you need me to transition, I'll hit my button and transition the slides.
Awesome. Thank you so much, Jason. Thank you for having me here tonight. I really appreciate it. So my evidence-based practice project that I did for my nurse residency program was about transgender patient healthcare experiences. And essentially, I just want to talk about my PICO question. We all had to come up with a PICO question. I'm sure you're all aware. It's population, intervention, comparison, and outcome. Sometimes there's a T in there for time, but I didn't really want to put a time constraint on this, although it is very timely, I think. So my PICO question was basically stated: among adult transgender patients in a healthcare setting, does having healthcare team members competent in transgender healthcare improve overall patient satisfaction with their hospital stay? And I had a couple people ask the relevance of this, and I assure you it is quite relevant. Recent Gallup poll survey revealed that 9.3% of all Americans identify as something other than heterosexual and cisgender, or as part of the LGBTQ community. So statistically speaking, we as nurses, we as healthcare professionals are going to come across LGBTQ patients, transgender patients specifically in our time as nurses. So they deserve the same level of healthcare as all of our other patients. And I think it's important that we learn about their experiences as well as everyone else's that we learn about. I did have quite a few articles that I went through for this project. I picked out 3 of them because I know we're trying to keep it brief here. But just to give you a couple examples of things that I was reading in the research, most recently last year, this Kimmel et al. Article was talking about how transgender patients more comforted, and they specifically sought healthcare providers, had providers who were well versed in transgender healthcare or even in just transgender experiences. There is pretty big lack of knowledge, I think, around transgender individuals in general, let alone their healthcare or their healthcare experiences. So I liked that this study was talking about how maybe it sounds silly, maybe it sounds obvious, but having that knowledge, having your healthcare professionals, your doctors, your nurses, your APPs, your OTs, your PTs, whoever, versed in some kind of healthcare that is related to transgender individuals, they as individuals really appreciate that. And as one of the other studies showed, there were 508 participants, almost 60% of which said they chose not to disclose their sexual orientation or their gender identity to their healthcare team. And that was largely based on the fact they were afraid of discrimination. And that just should not be. And then, of course, there was one other study in here I just wanted to point out, the Howard et al. Study from 2019. This was a study that looked specifically into the experiences of transgender people of color. And I feel like it's really important to say that transgender people of color experience healthcare much more differently than their white transgender counterparts. But, I found it fascinating and also horrible that these individuals were saying even LGBTQ friendly institutions, were often racist and maybe not even as affirming as they claimed to be. So I think it's important that nurses be aware of intersectionality of identities in our patient populations. So just a little summary here. Essentially, what I'm saying is trans individuals are facing unique challenges that are specifically related to their gender identity in healthcare settings as relevant to us. And in all of the studies that I looked at, even the ones I didn't show here, participants felt mostly negatively towards healthcare as a whole due to discrimination that they had experienced in healthcare settings, whether that was from doctors who didn't know how to prescribe medications, hormone therapies, or whether it was nurses who didn't have any idea about experiences that their patients might be facing or experiencing. Overall, the studies indicated that there is a severe lack of understanding of trans individuals among healthcare professionals, especially in rural hospitals and rural clinics. That was another study I I looked at was specifically rural clinics. So my proposal is kind of a large one, I guess, but a broader picture would be that universities, colleges, educational institutions need to care more or show that they care more about transgender healthcare. And I know that in the nurse residency program that I just completed last year, there were 2 really short and very basic presentations on LGBTQ experiences and identities. That's not enough. I'm going to say that is really not enough. We need to do better by not only our transgender patients, but also our transgender and LGBTQ identified nurses and advanced practice professionals, doctors, whoever. One of the questions we were asked for this project, this evidence-based practice project, we were asked if our issues that we chose to talk about were priorities to address. And I would say, given the level of violence and discrimination faced by this marginalized population, especially now in this country, this is a priority issue to address. Largest barrier, real quick, just wanted to say the biggest barrier is lack of education, because education is the key to understanding. And if we understand, we're more likely to want to advocate, talking about advocacy for these patients. Pretty clear that marginalized patients, marginalized populations require more advocacy than others. And I think that we as nurses have an obligation, really, to advocate for our patients and their safety and their rights and their dignity and their general human rights, their respect. And the last slide there is just my references.
Oliver, thank you so much. And I agree with you. This is a timely topic right now. I actually, I got into some spars back and forth, a polite set of spars with people who most recently, if anyone has heard about Representative McBride, and her colleague addressed her as the gentleman from Delaware. And, there's even on social media, there's a lot of people who will talk and say, we have to address people as how they were born, or, just comments that were just not considerate, uncaring. And, my feeling is it doesn't matter what your belief is. It costs me nothing to respect someone for their title, how they want to be addressed, just as someone may have a nickname or even their first name. I struggle and I get embarrassed when I can't even pronounce someone's first name, not to call you out, Eric. But you're right. It's caring about another person. It doesn't mean we have to maybe have the same beliefs, but we can at least have respect for people. And it costs me nothing. I mean, just it really, and I love that you talked about the intersectionality that exists even within the community, because we can't just think that we're part of this one acronym that we stand out for, that we're all going to have the same beliefs or even be supportive of one another. So, there's so much changing right now with DEI programs, and it is important because for our patients to feel safe, it makes a huge difference. Even when, we have our name badges, and some of them will have the rainbow, the emblem on there. And it just, for people to feel that they're in a safe space and for someone to just hear them is really important. So really well done. And I'm so glad that you presented. I want to open it up to other comments or questions for Oliver.
Just a
Derek.
quick thought, 2 quick thoughts. Yeah, the way that you described your work and recommendations and, especially your comments at the end, Oliver, it's so simple. I mean, it's elegant. It's elegantly simple. And you just make it so accessible. I loved the way you said that. Really well done. And then a little bit of a small world story. One of the authors on one of your sources is Ralph Plotzbaugh. Am I pronouncing that accurately? I said, how do I know that name? Well, I live in Dorchester in Boston. And when he was at UMass, we run an Airbnb out of our house. He used to stay here in this very house.
That's
so,
too funny.
and
A
of course,
small
I know
world.
he's moved to a small world. I know he's moved away, and gone to different places. So it's nice to know he's still in the biz. Nice. Thanks.
Thank you so much.
Nancy.
Yes, thank you. Thank you, Oliver. We need more of this type of information and this sharing in the nursing profession. I can't say enough about it. I loved, Mary, your comment, elegantly simple, and Jason, your comments, because it's just treating another human being as another human human being, whether you're a man or you're a woman, or you're not sure what you are, or you don't want to disclose what you are, or you do want to, it doesn't matter. It's who you are. It's my question is, Jason, I hope I make you smile, is have you thought about submitting for a presentation at our Region 15 Nursing Symposium in the fall?
I have not, but that will
I
be on
think
my
this would
radar.
be so informative. Okay, Jason, I see the smile.
Well, you're going to Oliver. Well, I hope you will. And in the chat, I did put our most recent newsletter that's come out and the call for abstracts. I would really love for you to consider
It would
that
be
and
great.
join us. We're going to be this year at the University of Vermont on Saturday, October 4th. And so I hope you will consider and, even pass it around to your other colleagues and peers. We'd love to have you there. Melissa, I saw that you had your hand raised.
Yeah, thanks. Oliver and I worked together, and Oliver, this was exceptional. Great job. I just wanted to, I guess, make a comment because I'm very passionate about this work as well. And I've done a lot of, one of my master's project was actually around this. And the research over and over says that trans patients don't want to have to educate their providers. And they get really tired of having to do that over and over with every healthcare provider they see. And interestingly, I participated in a survey of healthcare providers in Maine about collection of sexual orientation and gender identity data and what the barriers were to doing that. And over healthcare providers said they have discomfort in talking about LGBTQ subjects. And they talked about having a lack of dedicated time for education to feel more comfortable. And in my master's project, I remember reading that it was less than 20% of universities or accredited programs that had content related to LGBTQ curriculum as part of the nursing programs. And I think it's just kind of full circle. We know we need it. And then we come around to where we are politically. And I would imagine universities have fear of losing funding. They have too much DEI education. And it's just this, I feel like it's this constant struggle. And it really makes it harder to make this better and more accessible for healthcare providers. And it's really unfortunate because it's very much needed and it would provide better care for patients. But great job. I really enjoyed that.
Thank you, Melissa. I will also say, I have come across, like fellow coworkers who have said to me, when I talk about this project with them, like, oh, I'm presenting this project, they'll say, I don't really know anything about trans people. I don't really know anything about trans healthcare, but they want to know. Like I think it's one of the best things about being a nurse for me is like always wanting to learn more. You're never going to run out of stuff to learn. Like we're never going to know it all, right? Like, but people want to learn. They want to know. They want to provide better care for their patients. And like Melissa said, we work together, and on our unit, we have had many queer patients, many transgender patients who, they get different nurses every day and every night. And I have had multiple trans patients myself, and they have told me, oh, so-and-so didn't gender me correctly, didn't use my right pronouns, and I corrected them and they still didn't use the right pronouns. Or like sometimes they'll say, oh my gosh, it's really inclusive here. Like the atmosphere is really comfortable. Like I feel like I can be myself, and those kinds of things are really rewarding. And I just wish that we could do them more justice, by knowing more. And not to say that I know everything. I'm definitely not saying that.
Well, and on the flip side, it happens to healthcare workers too, because I've had, coworkers who have used they, them pronouns, or they've had that on their, name badge, and, patients will sort of cross the line a little bit. And so, I think this is a perfect topic. It's something we need to keep disseminating out to people and educating. So again, I hope you'll consider maybe submitting, and if not for our symposium, for another, but any support that you need at any time, I hope you'll know you can always reach out to me. Deb is an amazing resource as well. I don't have to say that, but just thank you so much for presenting tonight. This is very well done.
Thank you for having me. And thank you so much. I'm glad it was well received.
Absolutely. All right. Any other thoughts or questions? And I did want to highlight that Eric put a couple of relevant links in there that you might want to check out, Oliver, especially how, your work could also move into a global mini academy work with the Sustainable Development Goals and how that ties in. And I can say that it's an amazing group with a ton of support. I always say you get out of the things what you put into it, so something else for you just to consider. All right. Well, we have about 10 minutes left. Oh, Mary, you had your hand raised. I'm sorry.
No apologies. I only put it up a second ago. No, if it's all right, I'd like to take the liberty of putting in the chat a link to the co-op coordinated faculty position at Northeastern that I've been in for 20 years, but am retiring from on June 30th. And maybe, among yourselves and your colleagues and so forth and so on, it's a unique nursing faculty type of position and could be just the right thing for someone. So is that all right, Jason, if I little advertising there?
Absolutely. And if you want, there's the career advice forum on the Circle. I could drop that in and I can share that around if you'd like me to, share that link.
That'd be awesome if that's easy for you. That'd be great.
Yeah.
Yeah, absolutely. And as I put in the chat, I'm happy to talk with anybody who might be interested. 20 years ago when I took this position, I was not looking for a job. I received one of the flyers or something that went out, and it was, one of the best things that I never looked for. So anyway, thank you. And thanks for putting it in the Circle. That's great.
Yeah, not a problem at all. So couple of updates just to get it out there. So we have our Region 15 Symposium, Saturday, October 4th. The website is region15symposium.org. Call for abstracts is open. In the chat, I did put our latest newsletter as well as the call for abstracts. And I would just please ask all of you, share this widely, put it on your LinkedIn, put it on your Facebook, share it at your hospitals, your institutions, colleagues and peers. We have a great venue this year, and it is a venue that, as beautiful as it is also a little pricey this year. Our sponsorship committee is going to be working, and just want to put some feelers out there that we are going to hope that some of the chapters within our region might consider helping to sponsor the event this year, whether it's $25, $50, $100. We're going to be putting out a letter at different sponsorship levels. You'll get some space in a program, maybe some space on our website, maybe tickets to attend the event. We're working hard on that and trying to get some organizational support as well through institutions throughout our region. One of our big goals for the symposium is we want all students to attend for free. And that's a commitment that I am going to try very hard to stick to, and just want to put that out there so that if you are considering wanting to help sponsor the event, might know of organizations or other people we could reach out as sponsors or vendors, please reach out to me. Let me know. Our next planning committee meeting for the symposium is going to be on Wednesday, April 2nd. It's always the first Wednesday of the month. There will be emails that will go out just to alert that meeting, but wanted to give people some information during tonight on the symposium. Any questions about the symposium this year or about sponsorships, any of that? Okay. We talked about it. The Global Mini Academy applications are going to end on March 25th. I'm going to get this town hall out, the recording out, and I will highlight the Academy again. And even if no one's available for this next upcoming cohort, there will be one in the future in the fall, I think you said.
Yep, September, October is our fall rotation.
Perfect. The newsletter, again, is posted in the chat. Please feel free to download that. The links are active. We have some great highlights from some work that chapters have been doing. From Beta Zeta, we had a couple of their students who received awards at last year's symposium. Their stories are highlighted in the newsletter as well. And I would just put out that during these town halls, I love having our regional showcase. I think the value of just the presenters and the content and the information that we can get out is wonderful. I'd like to open these experiences up to more students, to colleagues, peers who may not be Sigma members, to come in, and hopefully they feel invited and supported. So please, if you or you know of someone who you'd like to have showcased at our next town hall. The next Region 15 town hall is going to be on Thursday, May 22nd at 7 in the evening. So you can mark your calendars, but of course, information is always going to be going out. And other than that, that is really all I had for this evening. If I can give you, end by 8, but anything else that people have on their minds, things that are going on within your chapters you want to share, events, we can open it up. And if people need to sign off, please feel free to sign off, and just thank you for joining. This has been great.
Thank you so much, everyone. Thank you, Jason, for hosting again.
Of
Thank you,
course.
guys.
Yeah.
And
Thanks,
thank you
everyone.
especially to Oliver. That was a great presentation. And Eric, it's nice seeing you again.
Great to see you as well, Cheryl. Well done, Oliver.
Thank you.
Thank you.
Well, good night, everyone.
Good night.
All the presenters, thank